June is Alzheimer's and Brain Awareness Month, dedicated to raising awareness about memory-stealing illnesses and encouraging all of us to learn more about risk factors and potential symptoms. Now, this is very important for the African American community since they are twice as likely to be impacted by these illnesses. And today, we have resources that can help. Our senior health correspondent Monica Robbins joins us live this morning with more on a Benjamin Rose Institute study that is looking for volunteers. And Monica, this is really important.
It really is, Danita. Thank you so much. And joining me is Donna Salaam, who is part of the research department at Benjamin Rose Institute on Aging, and she works for the Share for Dementia study that may be the answer to help people not only find resources that they need, but help science find some answers. Thank you so much for being here, Donna.
Thank you for having me.
Okay, so what is the Share for Dementia study?
So the Share for Dementia study is a study which was developed by Benjamin Rose, and it was developed and due to some other studies that Benjamin Rose did, and they discovered that the development that those living with dementia along with their care providers have strong values and preferences of care that need to be addressed. So that's initially how the study began, and it was designed to care plan for the family. What's going to happen in the future? Things are going to change. So Benjamin Rose has put together a program that's been around for over 2 decades. This is a well-known program that's been around for 2 decades that's designed to help you care plan for the future as the dementia disease changes for families.
So that's a great point. It's been around for 2 decades, so what people needed 20 years ago is not necessarily what they need now, correct?
Right, so what we know is things change and needs change. This particular study that Benjamin Rose is focusing on this time with the SHARE program is specifically for African Americans, right? So what we know, as they mentioned, African Americans is twice as likely as other races to have dementia diagnosis, and they get the least amount of help. And why? We know is due to lack of education, stigma, fear, all those things, those social attitudes which impact the decisions that are being made regarding African Americans and getting help around dementia.
Something else that's really important people need to understand is African Americans traditionally have been left out of dementia research. So something like this is critical to learn more. So, but another thing is important for people to understand is African Americans don't necessarily want to be in research studies. So how do we convince them that this is something they really need to take part in?
Well, first of all, Benjamin Rose does not want anyone to have to walk the dementia journey alone, right? So we have service and support outside of this program. We have other services. We have a hub of services that can help people who are facing dementia challenges and other health concerns. But it's very important for African Americans. Benjamin Rose realized it's essential to get the awareness out and the education for the Black community, as if there's going to be a change in the narrative of the dementia in this community, and it can be done, but it has to be done with the help of those out there in the community. What we know is 65% of Black Americans know someone who suffers with dementia.
So if they want help, they get resources as well. How do they get help? What do they need to do?
Well, what you need to do is, first of all, what we're currently doing is we're recruiting 120 families from around the country. This is a nationwide clinical research study that we're trying to do to change, again, the narrative for African Americans regarding the statistics and the disparities that are shown with African Americans in dementia. So first, we're looking for those who are 50 and over, who are African American, who are suffering with some kind of memory changes, cognitive changes, and some kind of dementia, maybe early to moderate stage. And the reason we're looking for the early to moderate stage is because there's a unique window of opportunity at that time for those who can care plan and talk about what are their needs, what would they like to see happen as the dementia disease changes for them.
And all they need to do is pick up the phone and call?
Pick up the phone, call us at Benjamin Rose. We're ready to screen you in. We're ready to help you. The biggest thing I want you to know is this is a free opportunity. Benjamin Rose is charging you absolutely nothing. In fact, for those who participate, you will get a small stipend for your participation, but more importantly, it's going to help with new developments and new ideas and effective ways to dealing with dementia. So this is very critical for those African Americans out there that have these changes in their memory care to come and participate in this free program.
And all these visits are virtual. They don't have to go anywhere, right?
This groundbreaking clinical research study is virtually offered. So that means you can participate anywhere in the country and be a part of this. We're going to have trained shared counselors who are going to be able to talk to you about some very intimate, very sensitive topics that's going to be confidential. We're going to provide you with a network of support, of services that are going to work for you now, but also in the future.
Great advice. All right, Donna, thank you so much for being with us and sharing this info.
All right, thanks for having me.